Abdominal palpation. This video is designed to assist you in developing your understanding of abdominal palpation, its associated terminology, its importance, and its practice. It will demonstrate the use of three basic techniques: inspection, palpation, and auscultation. Always be systematic in your approach. Start with inspection, move on to palpation, and finish with auscultation. Midwives perform an abdominal palpation in order to assess the growth and the health of the fetus. Adequate growth is an important indicator of fetal health. The growth of the fetus should be consistent with gestational age. Common indications for an abdominal palpation are at each antenatal visit from 25 weeks gestation, on admission to hospital or birth centre, during assessment of labour, prior to auscultation of the fetal heart and use of cardiotocograph, CTG monitoring, and prior to vaginal examination. Contraindications. Please note that an abdominal palpation should not be performed in suspected or actual cases of placental abruption, where a woman presents with vaginal bleeding or a tender uterus, nor should they be performed in suspected cases of preterm labour, as the uterus can be stimulated during examination and further exacerbate the condition. In either case, consult and refer to a more senior midwife or an obstetrician. Prior to performing an abdominal palpation, provide a full explanation of the procedure and gain consent.
Are you okay?
Yes.
Did you empty your bladder?
Yeah, I just went.
All right, so you're all right for me to have a feel of your tummy to determine the position of the baby?
Yeah, that'd be great.
All right, I'll get you to lie down. If you want to just take your shoes off. Just before you do, I'm going to check your due date. So you're due on the 13th of December?
Yes.
And today?
Hand hygiene should always be performed prior to and after touching the woman and the woman's environment. Inspection. During the inspection, observe the general size and shape of the woman's abdomen. Ovoid or an oval shape is the most likely. Note any skin changes such as pigmentation, stria gravidarum, or stretch marks. Also note any signs of previous surgery or scars.
Okay, so I'll just lift my dress.
Yeah, that'll be good.
Thank you.
Okay, your tummy looks beautiful. It's nice and soft.
Palpation. Palpation is performed to assess fetal growth, lie, position, and engagement. Growth is assessed by measuring the distance between the fundus and the symphysis pubis with a tape measure.
You comfortable?
Yeah.
All right, I'll just measure it. Great. So 36. Perfect. What it should be.
The findings from the fundal height will correspond with the fetal gestation. The midwife needs to palpate the fundal region, the lateral abdomen, and pelvic region.
I'll just have a feel of your top of your uterus. I'm just seeing where the bottom or the head is up here. Yep, okay. So the bottom's here. And there's some limbs on this side. And I can feel the firm baby's back on this side. Now I'm just going to have a feel for the baby's head. Sometimes it's a bit tender.
Okay.
So just take a breath in, slowly let it out. Great. You all right?
Mm-hmm.
I know it's uncomfortable. So that's, yep, so it's baby's head's presenting. I'm just going to see if it's engaged. It's not engaged into the pelvis yet, but it's just sitting there.
Abdominal palpation will determine the lie, presentation, position, and engagement of the fetus in relation to the maternal pelvis. The lie may be longitudinal, oblique, or transverse. In the latter weeks of pregnancy, the lie should be longitudinal. The presentation of the fetus can be cephalic presentation, breech presentation, shoulder presentation. The fetal position is defined as the relationship of the denominator to the 6 areas of the pelvic brim. The denominator is the defined point of the presenting part in relation to the maternal pelvis. The position of the denominator can be left posterior, left lateral, left anterior, right anterior, right lateral, right posterior. Pelvic palpation is used to determine engagement of the presenting part. This occurs when the widest presenting transverse diameter has passed through the brim of the pelvis. In a cephalic presentation, this is the biparietal diameter. Engagement is generally measured in fifths. Auscultation.
Just listen to the baby's heartbeat.
Yeah, that'd be great.
Can I just take your pulse at the same time? Thank you. Sounds great. Do you want to have a listen?
Yeah, I'd love to. Yeah.
This is the ultrasound Doppler, so just need to use some gel.
Okay.
You'll be able to hear the baby's heartbeat.
Oh, great.
It bounces off the water, the sound waves. It's a Doppler technology. Often they move when they hear their own heartbeat.
Oh, wow.
Sometimes they don't like hearing it. There we go. It's moving.
Oh, is that moving?
Yeah.
It's quite fast.
Yeah?
Is that normal?
It's about twice as fast as your heartbeat. That's why we check your heartbeat at the same time.
Okay.
See how it goes faster when they move?
Yeah. I can feel it moving.
Yeah, just wipe that gel off. Okay, well that sounds great.
Was the baby's heartbeat normal?
Yeah, so your baby's head's quite well down, close to your pelvis. The back's along here and the limbs are over here.
Oh, great.
Yeah.
To perform an auscultation, you will need either a Pinard stethoscope, a portable Doppler ultrasound, or an electronic fetal heart rate monitor. The practice is to place the stethoscope or Doppler over the fetal anterior shoulder and count the fetal heart rate for 60 seconds. The midwife should palpate the maternal radial pulse while listening to the fetal heart rate to ensure that the fetal heart rate has been heard.
Right, so if your pelvis is like this, the baby's head's just sitting there and the limbs are quite curled up. So it's just sitting like that.
Great. So it's not engaged yet.
Not yet, no. But it will. Okay.
So is that not a good side for it to be on?
Yeah, that's fine. When you start having contractions, then the baby will move down into your pelvis and rotate around to be born.
Oh, great.
They know the way out.
Okay, that's
Yes,
good.
They do. Okay, that's all I need to
Thank
do
you.
today. Great. Thank you. Okay, so you're feeling okay?
Yeah.
Yeah, and you're going to, have you got any other questions you want to ask me?
No. I think it would be, yeah.
All right, and you're coming back next week, same time, same day, same place?
Yep.
You're happy to come here?
Yes, please.
Okay,
Thanks.
great. Look
Okay.
forward to seeing you. Bye,
Great.
Hayley.
Thank you. Bye-bye.
The midwife should share the findings with the woman throughout the examination. Following the abdominal palpation, the midwife needs to complete contemporaneous documentation. This includes the woman's comments and observations, fundal height in centimetres, the fetal lie, position, presentation and degree of engagement, presence of fetal movements, fetal heart rate and equipment used, and any additional information, for example, contractions, amniotic fluid volume, and observations from inspection. Deviation from the expected growth and development should be discussed with the woman, and referral to a more senior midwife or an obstetrician arranged and documented as appropriate.